recently, if I go by your statement, you said India is not only a diabetic capital of the world, we are also becoming a fatty liver disease capital of the world. Now, what made you to make such a big statement? And also, do you think this will be an epidemic for a country?
So this is a very important point. Non-alcoholic fatty liver disease, and even without taking alcohol, liver is getting spoiled. Recently we have done a lot of research, epidemiological studies. We have found that 30% of Indian population and 30% of normal population is having fatty liver disease. Why? One is because Indians are inherently, genetically abnormal. Manaki genes, abnormal genes in dintlo because of the Indian subcontinent. Second is because the type of food we are eating, lot of carbohydrate based food compared to Western world protein food, mandi carbohydrate food. Third is recent context lo physical activity taggipoyindi anta kuda. All this taken together, this NFLD, non-alcoholic fatty is becoming epidemic. Anything reaching 30% epidemic hai kada. Even corona didn't reach this level.
Right.
Even diabetes has not reached this level. Even heart disease has not reached this level. So this is very, very important for public to recognize that we are in an epidemic of non-alcoholic fatty liver disease because of all these reasons, all preventable. So it's called non-communicable disease, NCD antam.
Right. So the next one, sir. So if I look at organized hospitals, these hospitals are being consolidated and more private equity players are coming in, and also hospitals are going public. Now, when these things happens, the biggest question is the fiduciary responsibility of the management is to look after the shareholders and their profits. But at the same time, sir, this increases the cost of healthcare to the general public. Now, as a institute, as a leading institute, do you have any plans to go public? That's one. Second, how are you trying to balance your shareholders' expectations at the same time providing an affordable healthcare?
So now coming to our hospital, I can talk about. We are not having shareholders we are not planning to go public or anything. This is a very unique type of institution we started, where we are autonomous institute which generates its own money, which is put back into the institute and put into research and education. That's the concept of the whole institute. So we are totally different from a regular corporate hospital.
Okay.
So there's no plans to go public or anything now. What all we get in terms of earnings from the patient, we put back, and this is an institute where doctors are not allowed to practice. No practice allowed. Every doctor is paid a salary like in All India Institute of Medical Sciences. So difference between All India Institute of Medical Sciences and AIG is that all the things are same, research is like this, salaries is there. Only thing is our doctors are paid better. Our management is managed better because it's not a government institute, it's a private institute. We are able to bring quickly. If AI changes, we are brought in 6 months' time, but it's not possible in All India Institute. So it's like a All India Institute running in a better fashion. That is one. Now regarding the other question, which of course you are asked very rightly about, corporate hospitals having shares, having public equity players playing. So that is a very complex question. As a simple answer challenge is not possible. But what happens is when you are running a very high-end hospital, you require certain very high-end equipment, which is all imported now. India imports $8 billion worth of medical equipment every year, which unfortunately should change. That's a different concept. So the equipment is there. So you're getting high-end equipment. Getting doctors who are also very highly qualified is costly. So when you put it, naturally there's some amount of cost which is added to corporate hospitals. With private equity and all coming in, there is going to be certain amount of course, financial equations that are coming in. So each hospital has to balance what is best for it, how much they can put into social service, how much they can put into the research component, and how much the management should have. So this is a very individualized one. It is difficult to comment on a general thing, but hopefully everybody gets mature enough to know that we have to give back to the society certain amount of benefits. Only then everybody grows together.
Understand, sir. So based on your observations, 60% of Indian population are overweight and 30% are on ought to become obese. And also, in addition, your recent limited research around the IT employees in Hyderabad shown that 80% of them are overweight. Now, there are many factors at play for these reasons, for these factors to become at this scale. Now, what recommendations, what do you think at the state government and federal government should do in terms of policies to prevent this rather than curing?
No, this is a very important point. Preventive actions are better than curative once disease. So the government should take this on a massive scale. One is prevention can be done. We know that prevention, all these are lifestyle diseases, prevention can be done. Proper diet, exercise, sleep, and adequate social communications, all this together, I think media, social, everything plays a role. But the government should also take this into view and put itself into large scale education. One. Second thing is what happened in US also, this when this problem, Obama care came, where insurance is paying for preventive health. So every year, any employee can go and get himself checked to see if any possible disease, preventive health ki, what are the changes he requires, and insurance pays for that, say 10,000 rupees a year, and insurance pays for that. Unfortunately, in our country, we don't have that. If you go for preventive health, you have to pay a lot of, so people are not coming for a preventive health checkup. So we should encourage preventive health checkup, we should encourage lifestyle changes, we should encourage the public about the diet, especially the ultra-processed food, sodas and all should not be taken. They cause maximum harm. Government should see that these are not used in advertisements. We should be very serious about this. There is no point in banning advertisements on smoking and alcohol, whereas these people, these foods, ultra-processed foods, sodas are causing more harm.
Okay.
So government should take strong action to, so that is from the government side. Individuals also should by themselves realize what is the reason for this and start taking action.
And so you are saying that there must be strict food regulation,
yes,
regulations,
policies. Food regulation should be extremely strict by the government. Only then the overall health of the public. Most of the IT people are eating fast foods. They have short time sodas they are drinking. All this, and then they are not exercise ledu.
Right.
They are going in lifts of the building. You put a rule that up to 4th floor everybody should walk only, no lifts, that type of thing.
Thank you, sir. Thanks for the opportunity and thanks for your valuable input, sir.
Thank you.